the medical community, as you can imagine, is quick to challenge the findings of the White House.
Joining us now is Dr. Pyle Coley, adjunct professor at St. Johns Hopkins, and Duke with a closer look at these claims. Really appreciate you coming on this morning. This is such an important story, Doctor. Let's just start with the basics. What does the science say about a link between Tylenol and pregnancy?
Good morning, guys. Certainly, this has the entire medical community buzzing because what we've known for some time that Tylenol, which is also acetaminophen, that's the generic name, does have a link with autism spectrum disorders. And that's what I call a correlation or an association. Now, notice I'm not saying causation, which means we don't have science that proves that it causes autism spectrum disorders. So could the Tylenol just be a marker of risk, a marker of something else like infection or fever or migraine that's actually causing the risk? And the Tylenol itself is not causing the risk. That's called confounding. So when you look at studies that look at sibling pairs, one sibling was exposed to Tylenol during pregnancy, the other wasn't, same parents, same environment, we don't see much of a difference, which is why the medical community doesn't believe that Tylenol or acetaminophen necessarily is causal.
Dr. Coley, pregnant women for years been told to take Tylenol and not take Advil, right? Like that was kind of drilled into my head through my 3 pregnancies. So this is really stunning. So what's going to happen in the doctor's offices when pregnant women walk in? Surely, this has just come out. What are doctors to do, and why do so many professional groups of doctors still consider acetaminophen safe?
Well, more than half of women take acetaminophen during pregnancy, and we tell them to, just like you said, because in fact, it is one of the safest options, and nothing in the science has proven otherwise yet. We just have this as potentially being a marker of risk, but not necessarily that it's causing risk. And if you look at the alternatives to acetaminophen for pregnant women, for pain, for fever, for infection, the Advil, the ibuprofen, the non-steroidal anti-inflammatories carry much more risk. And the idea of not taking anything when you're in pain or have a fever, that carries much more risk to mom and to the baby because we know that causes harm to the placenta and to the developing baby. So I really want women to not be fearful of acetaminophen during their pregnancy. Nothing new has changed in the science. The studies have not been conclusive to establish risk. And we've been using it for several decades. We know that autism spectrum disorders are really multifactorial. There's no one thing that causes it. So I don't think anything should make women worry or be afraid to take Tylenol if they need to take it.
Yeah, the Journal of American Medical Association agrees with you in their research. But I just want to go back to your first answer to what there is some link, some suggestion. If you could just elaborate, because I hadn't actually heard that on what the data shows that there could be something in Tylenol that's impacting this.
Yeah, absolutely. So there's really 2 big studies that we look at. One was a study done in 2019 looking at umbilical cord blood and actually measuring levels of acetaminophen. And there was what we call a dose-response relationship, meaning the higher the levels of acetaminophen in the umbilical cord, meaning the higher the baby got exposed to, the higher the odds of developing an autism spectrum disorder. Now, again, this could just be a marker of something going on with mom during the delivery or right around the time of delivery that led her to take more Tylenol that then potentially led to this. It doesn't establish causation, but certainly raises the suspicion of an association or a correlation. And then in 2025, just a few months ago, we had a large, what's called meta-analysis, where they put a bunch of smaller studies together and try to look for trends. So they put 46 studies together looking at acetaminophen during pregnancy and neurodevelopmental disorders. 27 came out positive, showing a potential association. 9 came out null, saying there was no association. And 4, in fact, came out protective, saying that Tylenol use may actually be protective. So the science is really very confusing and very complicated. It makes us want to look more closely at women who take Tylenol, but I really think we need what's called these sibling controls, where we're controlling for the same home environment, the same parents, the same genetics, the same exposures, and then seeing if there's a link.
Right.
I just got to say, we are very fortunate to have the best television doctor in the country. I mean, I'm really, truly
that was a good breakdown.
Blown away by the research
Thank
you just
Dave.
recited.
I'll pay you later.
If you were pregnant tomorrow, would you feel comfortable taking Tylenol?
100%. In fact, I'm telling all my pregnant patients not to worry at all about taking it. Now, here's what I'll say. When you're pregnant, you limit the dose and you limit the duration. So you definitely want to be sure you're not going on taking all kinds of things every ache or pain. You don't want to reach for Tylenol. But if you're in significant pain, that releases harmful inflammatory chemicals to baby and to you that could impact your pregnancy. You do not want to be fearful of Tylenol. And the American College of Obstetrics and Gynecology, the Autism Science Foundation, the American Academy of Pediatrics all stand behind these recommendations. And I would say the same to your child once they're born. If they have a fever, young kids are high risk for what's called febrile seizures, which means they can seize and have complications from the fever. You want to give them Tylenol to reduce that fever.
And also, you hit on something that's so important. When a pregnant woman is in pain, she's in distress, she's in stress, and we know that that can have ramifications. Question for you: how dangerous could it be to ignore vaccine schedules, which is something that President Donald Trump also mentioned yesterday? And can you shed some light on that?
I mean, this is incredibly dangerous because we know for a fact that science has proven no causal link between vaccines and autism spectrum disorders. We know for a fact that these vaccine schedules, which have been around for decades, have
Thank you very much.
eradicated diseases like polio and
So
until
we've been
earlier
working on
this
this movie
year,
for 20
measles.
years.
So I feel like ignoring the vaccine schedules is poking the bear. It's asking for trouble. And we know that little babies, newborns, have immature immune systems. So you're really exposing your child to risk by ignoring the vaccine schedules that are so well established.
What do you know about this leucovorin as a potential autism treatment? The president has mentioned it.
So leucovorin is basically a metabolite of folic acid. It's an active version of folic acid. And in some kids, we found that folic acid, which is responsible for brain development and for communication between neurons, is deficient, or they have antibodies against the receptor that prevents them from using it. So in those children that have that specific antibodies, it has shown some promising benefit, and that's in small clinical trials. Now, it's not a first line treatment by any means. It's not a one size fits all for all autism spectrum disorders. But if you have a problem with folic acid metabolism and you give them a active version of folic acid, which is leucovorin or folinic acid, it really can help improve some of those behavioral symptoms. In general, it's a safe treatment because it's derived from a vitamin. So they're studying it still for more broader use, but it's really only been studied in those particular kids at this point.
Dr. Pyle Coley, the best television doctor, full stop.
Phenomenal.
You're the best. Thank you.
And I will tell you, this is really going to be a firestorm. This story is not going away because this is going to, pregnant women already are under so much stress. And you have doctors like Dr. Coley who's saying 100% your question, would you take Tylenol if you were pregnant?
Absolutely,
She said 100%. Yeah.
But there will be 100% millions of women who stop the
Absolutely.
use of
They'll
Tylenol
be confused.
tomorrow.
They will not know what to do.